Have you ever used melanotan to raise alpha MSH for chronic Lyme and mold?
Absolutely. It's a later stage treatment. It's later in the treatment. Again, you have to remove the mold first, which most people aren't willing to do or unable to do. And then you have to remove the mold toxin with some sort of binder. And this takes 3 months or so. You can be doing things like TA1, BPC157, RG3 in the meantime, because those are all anti-inflammatories that are going to help your brain. But you have to be careful when you get to, you really don't want to treat that alpha melanocyte stimulating hormone until the end of your treatment. You don't want to raise that right away. You want to use the other inflammatory modulators first, and you'll use that. If you use VIP, your melanocyte stimulating hormone will go up. And your VIP should be low if you have SIRS, or most of the time is low if you have SIRS.
Interesting. Very, very interesting. Let's see here. The next question is, I've had some luck with okra pepsin. I don't know, by standard process. Do you have an opinion on it as a gut healing tool?
It's going back to exactly what Carl was saying before. So the okra is mucin, which is the same things that's in aloe. And that slimy stuff that no one likes to eat that's in okra is the same stuff. And so it goes into the intestine, helps create that lining back again. Absolutely. I do think standard process things have a little bit low dose, but most often people don't need a huge dose, especially our multiple chemical sensitivity. You might respond to a very small dose, but that has the, I'm not sure if it has betaine in it or not. I think that product has betaine. I can't remember if it has just the digestive enzyme pepsin, which is a little bit limited. You need a little bit broader spectrum digestive enzymes if you're going to use them for inflammation.
So I did a show. I'm trying to recall what it was, but it was with a gastroenterologist, and during the show, it was mentioned that when you fast, especially for like intermittent fasting, long fast, 16 hours, the body seems to move a lot of toxins into the gut, and that there's an opportunity to take micronized charcoal,
yes,
and with a little water swallow it, and that will actually bind to things in the gut that you want it to carry out of the body. Any truth to that?
You can use bentonite clay. You can use pyrophyllate clay. I think that the Biocidin people make that one. There are several binders that you can use. The one that has the most binding sites is the cholestyramine powder. It tastes awful, but it is available, and it's got sugar in it, so you're kind of a little counterproductive if you can get it compounded, but that's also another. The compounding one is more expensive.